episode of A to Z of diabetes conducted by Day. This is the final session in the second season, which has been conducted by Day. From childhood, we have seen that every unknown quantity has always been marked as X, which will be our first letter of discussion in today's topic. And to summarize anything, the most asked question is why? Why is it so? Or why is such thing happening in our life? So here comes our next letter, Y. And of course, when there is X and Y, how can we leave Z behind? So, which will be our next last letter of discussion in today's session. So today we will be presenting the XYZ of diabetes, and representing X will be the presentation on xerostomia in diabetes. Before starting to talk about it, I think we should all take a small sip of water to remove the dryness in our mouth, which is actually xerostomia. According to the studies done by a dental clinic, almost 76% of xerostomia patients are either diabetic or pre-diabetic, and their treatment becomes tougher with incidence of diabetes. As oral candidiasis, tooth decay, and overall general deterioration of the tooth causes more distress for the patients. Let's learn more about it from our senior dietitian Komal Srivastava. She will be talking about xerostomia in diabetes. She is a MSc from Bharatiya University, Coimbatore, Tamil Nadu. She has completed her B.Ed from J.D. Birla Institute, Kolkata. She is a certified diabetic educator from International Diabetic Federation, Australia, and she is heading the Master Trainer for Diabetic Education in Project Hope by IDF. She has a degree of ENS from Ludwig University, Germany. She is a PhD scholar and has been eagerly waiting for her result. She has 5 international publications and 1 chapter publication to her credit. At present, she is working as a senior dietitian at Apollo Multispecialist Hospital, Kolkata. Over to you, ma'am, for your presentation. It would be nice to know about something which is unknown to us all in detail.
Thank you very much, Aparna. So I'll share my screen now.
Yes, ma'am. I will just stop it and you can share it. Yes, ma'am, you can share.
Is my screen visible?
Yes, ma'am. You can make it full screen.
And that's what I'm trying to do, but yeah. So thank you, Aparna, for the, introduction. So now without wasting time, I think I should move forward with the topic of the day, which is xerostomia in diabetes. So it is the X topic, what has been given for the diabetes for the day to me today. Going to the introduction, dry mouth, or the scientific name of dry mouth is basically xerostomia, and the word dry mouth itself reflects a condition wherein there is no saliva production. So that means when there is no saliva in the mouth, or there is no enough saliva in the mouth, it results in a condition which is called as xerostomia. It is one of the most common symptoms which is seen in people having diabetes. And it is not always, it is basically seen in both type 1 and type 2 diabetes mellitus patients. But having diabetes does not only mean that the patient will have this problem. It can be because of some other complications which or other treatment which the patient is going through. So it is not basically that only the diabetic patients will have this xerostomia. It can be your cancer patient who is receiving chemotherapy or radiation therapy or some other antidepressant drugs or antihypertensive drugs. They also might suffer from this xerostomia problem. So dry mouth occurs when there is not enough saliva in the mouth, as I have spoken about it earlier. Now coming to the scientific, experience or the problems what people with dry mouth experience is basically a frequent dry feeling of the mouth, because as mentioned, they don't have enough saliva production. There will be a pain in the mouth for
Sorry
patients.
to interrupt you, ma'am. Your slides are not changing.
I have not changed my slide yet.
Okay, fine.
It's the first introduction slide only.
Okay, ma'am.
Okay, so according to the NIDDK, which stands for your National Institute of...
Screen is not changing.
Screen means, can't you see my introduction slide?
Ma'am, we can see xerostomia in diabetes by Komal Srivastav. That's the first slide.
Now?
No, ma'am. Ma'am, you have to go. Yes, now we can see, ma'am, the introduction slide.
But when I'm doing F5, I think there's a problem. Wait.
Ma'am, you have to go on slide share.
So
and
the
then...
screen is not full screen.
See, I have done slide share. You can see my this thing. Wait.
Ma'am, we can see your slides, but it is not full screen.
Yeah, when I'm doing full screen, then you are unable to see my rest of the slides. Just wait, I have just stopped sharing. I'm sharing it again. Is it visible now, Aparna?
Ma'am, it is visible, but it is not full screen. We can see your slide as well as the corner slides also.
Yeah, just wait a minute.
You have to go on the slideshow, ma'am. Slideshow from beginning, if you write.
Is it visible now?
No, ma'am. I think
she is doing from the tab, so it will not change.
No,
so
it is from the laptop, Shumindu.
Okay, then one by one you have to change manually.
That
yes,
is okay,
now
but
it is changing.
But in slideshow sharing, it is not coming. I don't know why.
Not coming. Sometimes it happens.
So what
yes,
do I do, Aparna? I'll share it this way only, then it becomes easier.
Yes, ma'am, you shared it this only. You have to change it manually.
It's okay. That I will do.
Yes, ma'am.
So I'll start right from the starting.
Yes, ma'am, you can.
Okay. So now moving to the introduction. Dry mouth, the scientific name of dry mouth is xerostomia, and it occurs when there is not enough saliva in the mouth. So it is one of the most common symptoms of patients having diabetes, and it can be seen in both patients having type 1 and type 2 diabetes mellitus. But that doesn't mean that all patients having this diabetes mellitus will experience this problem. The other reasons or complications may also result in this dry mouth, like a patient undergoing chemotherapy or undergoing radiotherapy. Because of those side effects, those patients may also suffer from this xerostomia. Dry mouth may occur when there is not enough saliva in the mouth. Now coming to the scientific body, like according to NIDDK, which stands for your National Institute of Diabetes and Digestive and Kidney Disease in US, people with dry mouth may experience a frequent dry feeling in the mouth. They may complain of pain in the mouth, difficulty in eating, talking, chewing, or swallowing of food, sores or infections in the mouth, a dry or rough tongue. Now coming to the another body, which that is ADA, American Dental Association, they noted that dry mouth may also involve a sore throat, nasal dryness, and hoarseness of the voice. Moving to the prevalence, the NIDDK, which I have already mentioned, that National Institute of Diabetes and Digestive and Kidney Disease, they listed that dry mouth is the most common problem that people living with diabetes mellitus experience. Its high prevalence in this population may be due to dehydration. We know that polydipsia is one of the major, symptom of patients having this diabetes mellitus, and which leads to dehydration. Uncontrolled diabetes mellitus or hyperglycemia is the background for which results in your dehydration for the patients. So when there is no enough body fluids, or if the body is dehydrated, definitely the oral region of the patients or the person will also get dehydrated. Kidney conditions. So over time, if the sugars are not under control, it may result in your kidney disease. And because of this kidney diseases, there is changes in the renal parameters like your creatinine and your urea. So because of this elevated creatinine level, it results in a sort of a metallic taste or a change in a taste buds of the patients. For this also, the patient might have this dry mouth or xerostomia. There are certain group of diabetes medication which results in your dry mouth, which is one of the side effect of that drug. So basically metformin is a class of drug which may result in your xerostomia or dry mouth. Now, moving to the functions of saliva. Saliva plays several important roles in the mouth, and the most important among those are maintaining a health of the soft and hard tissue, washing away food and debris from the mouth. So continuously, when we swallow saliva, whatever food particles are there stuck in the mouth after eating, if we don't wash or rinse from with water, it just goes away with the saliva. Neutralizing the acids in the mouth that bacteria produces, and it helps against fighting against microbes, and also prevents the overgrowth of many diseases which may result from the accumulation of bacteria if food particles stays for longer period of time in the mouth. And if this xerostomia or dry mouth is not treated, it may result in your tooth decay, gingivitis, which is again, the gingiva of the oral cavity gets affected, infected, and it may result in the complications. Then periodontitis, which is again the tooth enamel of the oral of the teeth gets infected, which is again a serious condition. And then the oral thrush. So oral thrush is something, when there is dehydration in the body, where there's no enough saliva production in the from the salivary glands. So what happens? It results in the accumulation of certain type of bacteria in the mouth, which results in this oral thrush. So again, it is also a complication, a serious complication, because if there is oral thrush in the mouth, the tongue and the inner part of the cheek gets white and the patient cannot eat properly. So somehow the nutrition of the person also gets affected if this dry mouth or xerostomia is not treated in time. Now coming to the treatment, so people who experience dry mouth may result people who experience dry mouth as a result of medication can definitely ask a doctor about the possibility of switching medication. So the person should not be, sitting back at home and then, oh, okay, fine, I will see what will happen in next couple of days. That this scenario should not be there. The patient should be, educated the side effects of the treatment. If there is any side effects, they should report back to the treating consultant. Managing any underlying condition, for example, keeping the blood glucose levels within the safe range. This is very, very important, because if the sugars are under control, the chances of, having this dehydration, having this dry mouth, and then this oral thrush, all this will be definitely under control. So healthcare professional can also prescribe medications to stimulate saliva production. So there are different form of gels, sprays, and lozenges available. So for diabetic patients, now there is a concern that if it's a normal sugar coated lozenges or sprays or gels. So it might result in, rising of the blood glucose level. So nowadays we find n number of sugar-free products. So what the product they uses, xylitol, which is basically a sugar-free, it's a very, very sweet taste product, and they are using this as for making products for diabetic patients, because it doesn't affect the blood glucose levels of the person. And when we talk about the other remedies, there are certain tips which we can definitely take up at our own level, which is like the person having this dry mouth may avoid spicy and salty food because it may aggravate the irritation of the mouth. Sipping water slowly throughout the day. So it is not that the person, say, suppose I spoke about the kidney patient, the patient who is having diabetes mellitus, hyperglycemia, and then the person is having kidney issues also. So when the kidney problem is there, definitely the water also gets constrained. So there is fluid restriction. So when there is fluid restriction, it may the person cannot have a lot of water throughout the day. So for those patients, they can sip water, slowly and gradually in between meals, so that the mouth gets, hydrated. Chewing sugar-free gums and sucking on sugar-free candies then definitely stimulates saliva production. Sipping water or sugar-free drinks allow the foods to, the person to swallow the food. Refraining oneself from alcohol and tobacco. Using a humidifier when the person is sleeping, and then avoiding caffeinated beverages. So from my personal experience, what I can share over here is like patients who are having this dry mouth, what we usually suggest is like sucking of ice. So when the person sucks the ice, the mouth automatically gets hydrated. And when the person sucks that, the feeling of goodness also comes. And the person with having this problem of dry mouth or xerostomia can overcome definitely when the person is eating a food. Because when there is some problem with the oral cavity, at one point of time the nutrition gets affected. So to overcome that, along with the medications, along with the other remedies, this is simple thing which we can definitely ask the patient to do, so that the patient can eat properly or a proper meal at that particular point of time. And because, as I mentioned, because of this kidney disease, because of the elevated creatinine level, the metallic taste develops in the oral cavity of the patient. So when the person is about to take his lunch or dinner or the meals, if the person rinses the mouth thoroughly, that metallic taste will also go, that the accumulation of that taste will go away from the rinsing of the mouth. So now what will happen, the person will have a little bit of the taste bud will get activated, and then at that point of time, if the person eats, then definitely he will eat a little much more in quantity as compared to when without rinsing the mouth. This is something which I have seen in my this is something from my experience what I can share for this problem. And that's all for the presentation today. Thank you very much.
Thank you so much, ma'am. That was a fantastic 10 on 10 presentation. We can say 10 on 10, as it were representing X, and X in Roman number is 10. So that was a fantastic 10 on 10 presentation.
Thank you, Aparna.
Very well explained about the causes and the treatment and the precautions which we should take regarding this for a diabetic patient, because they really complain, and it's very difficult for them to have food also when they suffer from this, because it becomes difficult for them to swallow and everything. We would be requesting you, ma'am, to stay with us in case we get any questions. We can ask you at the end of the session.
Sure.
Thank you so much, ma'am. So now moving ahead, we will be having another quizzical letter, which is Y. Y is a quizzical letter which is there in every quiz. Y, that's why. So Y is the yeast infection in diabetes. Increased sugar level elevates the platform for natural growing yeast in our body to grow in greater number and cause infection. Simple? No, it's not that simple. It's really tough for the patients to deal. And especially we have seen these kind of trouble in women more than in a male. So I would request to please take the session by Kalpana ma'am, who would be explaining the yeast infection in diabetes. Just a minute. Ma'am has done her BSc in zoology from Guwahati University. She is a diploma in dietetics from All India Institute of Health and Hygiene. She is MSc DFSM from IGNOU. She is the HOD from Park Clinic Nursing Home Dietetics Department since 1996. She is a joint convener, capacity building subcommittee of diabetes awareness and you, and she's the course director of RCCD. She has experience of more than 2 decades in this field. She's associated with number of other hospitals, clinics, and corporate offices. Her passion for cooking in making healthy food is we all know about. So welcome you, ma'am, on board to take the session forward.
Thank you, Aparna. Very good afternoon to everyone. I'm sharing my screen. Is it visible?
Yes, ma'am, it is visible. You can make it full screen, ma'am.
I'm trying.
Okay, ma'am. Yes,
Is it
ma'am.
okay?
Yes, ma'am.
Okay. So, already Aparna explained my topic, that is yeast infection. Actually, yeast, already Aparna told that yeast infection is a common condition that occurs from an overgrowth of yeast, that is a type of fungus in the body due to weak immunity or change of environment. In our school or college life, in microbiology, we have read that microorganisms need food for their growth. And yeast food is sugar. Now, people with diabetes who have elevated blood sugar level may be prone to getting yeast infection. The term yeast is often used to describe infections caused by fungi, which are microorganisms that appear most frequently in nature as molds, mildews, mushrooms, and yeast. They are more complex than other viruses or bacteria. Yeast infection in diabetes is a disease. All of us know about what is diabetes. That is elevated blood sugar. While yeast is not typically found in the bloodstream, with the exception of invasive candidiasis in people with advanced HIV, any rise in blood sugar can alter the glucose concentration in mouth and vagina, helping yeast grow. With that said, the occurrence of candidiasis people with diabetes is driven not so much by the consumption of sugar. Mean to say, chini khele, meant to say, if you have sugar, that means that will not lead to like yeast infection. Actually, hyperglycemia is the main cause for yeast infection. Now, who are risk in infection? A person with poorly controlled diabetes has an increased risk of more severe and frequent yeast infection. Now, researchers are still trying to pinpoint the link between yeast overgrowth and diabetes. Nearly half of all diabetes patients had at least one hospitalization or outpatient visit for infection complication in diabetic patients. Infection may increase the morbidity and mortality in diabetic patients. That means diabetic patients are more prone for any type of infection. Some review studies, researchers have found a link between high blood sugar level from diabetes and vaginal infection. People with type 2 diabetes may be even more susceptible to getting vaginal yeast infection, likely because they have more sugar in their system, disrupting the vaginous balance of bacteria as well as yeast also. Then another study says when blood sugar levels are high, the body starts to get rid of excess sugar through bodies, including vaginal secretion. Yeast gets its energy from sugar because already I have told that yeast food is sugar. So this vaginal environment is easy for yeast to multiply, overgrow, and turn into yeast infection. High blood sugar also interferes with immune system functions, and that helps fight off yeast infection. This means uncontrolled diabetes can make it more difficult to prevent and get rid of vaginal yeast infection. Some studies again. This is again another study, a case control study to evaluate candida parameters in the oral cavity of patients with type 2 diabetes mellitus. The aim of this study was to evaluate candidal parameters in the oral cavity of patients with type 2 diabetes mellitus. This is the materials and method. In group A was 50 with type 2 diabetes, and the normal persons was 30 subjects. Non-random consecutive sampling technique. This is a material and method. The results found that there is a significant differences in saliva and swab. These are candida growth between people given normal healthy meter. Ultimately, the conclusion of this study is this study concludes that diabetic individuals are prone to hyperglycemia state, turnover the growth and establishment candida species, and further study also needed. This is the reference also there. You can see from that reference again and go to the next slide. As a 2018 study, which included data from over 3 lakhs people, showed a person with type 1 or type 2 diabetes mellitus has a higher risk of infection, including yeast infection, than a person without the condition. That means diabetes are more prone to infection. Basically, Candida species is the main culprit of yeast infection in diabetes. Several mechanisms are attributed to higher Candida species predisposition among diabetes mellitus patients depending on the local or systemic infection. Yeast is most likely to grow excessive in areas that are warm and moist, including the mouth, the genital area, the feet, and the skin folds. This is again candidiasis was increased subsequently worldwide over recent decades, and this is also one study cause morbidity and mortality, especially among critically ill patients. Diabetes mellitus is a metabolic disorder that predisposes individual to fungal infection, including those related to Candida species due to immunosuppressive effect on the patient. Results of the review show that diabetes mellitus patients have an increased susceptibility to Candida species infection, which aggravates in the cases of uncontrolled hyperglycemia. That means hyperglycemia is the cause line. Then why diabetic patients are at increased risk to have infections? Host-related factors are vascular insufficiency, sensory peripheral neuropathy. We know that diabetic patients have sometimes nerves problem, blood circulatory problem, then autonomic neuropathy, then hyperglycemia and metabolic dearrangement in diabetes, then immune defects in diabetes, increased skin and mucosal colonization, for some surgical site infection. These are host-related factors, and organism-related factors are Candida species and Rhizopus species. Then certain diabetes medications also responsible for vaginal yeast infection. Class of diabetes drugs known as sodium glucose co-transporter 2 SGLT2 inhibitors are used to help lower blood sugar. These medications work by encouraging the body to offload excess sugars through urine. Through urine, sugars are drained off. This means sugar is passing through the urinary tract more frequently, potentially feeding the growth of a vaginal yeast infection. Because yeast, they are getting their food in the urinary tract and they grow according to that. They can reproduce more and more. These are the sites like yeast infection affect different part body in different way. Like skin infection, the skin may change color, itchy patches, or varying shapes and sizes. These symptoms usually develop in skin folds, but they are different parts of the body, including the face or trunk, is in the scalp also. The name for is skin cutaneous is infection like. Then genital infection, these are more common in females than male who are difficultly manage their diabetes. Females and actually among females, these genital infections are more than male. Female with diabetes are more common than male with diabetes for genital infection. A female may notice vaginal itching or pain, including burning sensation, a white cottage cheese-like discharge, then burning sensation or another type of pain, or when they are urinate, an unpleasant odor also. And for male, a male may have an itchy, scaly rash on the penis for genital infection. Anyone with diabetes who notice these symptoms should see a doctor because these are likely to need treatment. Without treatment, complication will be arise. Eye infection symptoms include trusted source, pain, redness, blood vision, discharge, sensitivity to light, and watery eyes without treatment, and it is difficult for manage. So you should, people should notice that. Sometimes, actually, what happens, sometimes for small problem, we are not going to the doctor and we are neglect those. But we should not neglect, especially diabetic patients, they should not neglect anything. They should consult at least with diabetes educator or with doctor. Another problem is like food infection. Athlete's foot is a common fungal infection for a person. Diabetes damage to the skin on the feet can lead to ulceration, soreness, and in advanced cases, amputation also very common if that is associated with some nerve-related problem, circulatory problem in diabetic patient. Then another side of problem is like oral thrush. According to the Centers for Disease Control and Prevention, symptoms thrush include trusted sources, white patches on the inside of the cheeks, redness of pain in the mouth, cracking and redness in the corners of the mouth, loss of taste, a cottony sensation in the mouth. A person with diabetes has a higher chance of developing a fungal infection for various reasons, can cause trusted source, dryness in the mouth, what already Kumul has discussed, and then acidity and high level of glucose in saliva. Without treatment, yeast infection can become invasive trusted source in a person whose immune system is not working properly. It can spread to the bloodstream and from there to other parts of the body. If this happens, the infection can quickly become life-threatening. These are all in the right side areas of infection which is responsible for candida species in diabetes. Cerebral abscess, oral candidiasis, COPD, fungal, liver transplantation during candidemia, arteries, peritonitis. Already I have discussed all the parts like nail and fungal infection, also skin abscesses. These are the site for yeast infection. Then come to yeast infection test. The type of test depends on the location of symptoms. If a vaginal yeast infection is suspected, healthcare provider will perform a pelvic exam and take a sample of the discharge from vagina, and they can test that in the laboratory. And for thrush or oral yeast infection, healthcare provider will collect some saliva and that is examined under the microscope. And if the yeast infection is suspected on the skin or nails, healthcare provider may use a blunt edged instructor and scab off a small bit of skin or part of a nail for examination. Treatment, first thing is blood sugar control. That all of us already know that for diabetes control, for especially for type 2, one should maintain like lifestyle control by diet, exercise, and proper medication. If the patient is on medication, they should take the proper medicine and monitoring everything. Anyhow, they should control their sugar, like otherwise this problem may arise. Like there are a few options to treat a yeast infection or symptoms severe the cases. Some medications are also there, like difluconazole. Then some ointments, antifungal ointments are there for local application. Different courses of treatment have slightly, it takes at least 7 days for cure. And sometimes these infections are repeated and take time also if it's a severe type of yeast infection. And repeated infection also very common. Diet management, carbohydrate, the most widely discussed aspect of the Candida diet. It's called Candida diet. Candida diet is the strict avoidance of sugar, simple form of sugar. This may particularly relevant for women with diabetes who are 63% more likely to get yeast infection than non-diabetic women. That means women are more, already I have told that women are more, that means target for the yeast, like. And this is according to 2014 study in Sao Paulo Medical Journal. That is, this may be particularly relevant for women with diabetes who are 60% more likely to get yeast infection than non-diabetic women. At present, there is little to no evidence that restriction of carbohydrates or the use of low-carb diet has any impact on the incidence or severity. Actually, a simple form of carbohydrate should be avoided, and complex form of carbohydrates are prescribed. Probiotics, the use of probiotics in treating yeast infection is controversial, although probiotics work by increasing bacteria beneficial to the vagina and gastrointestinal tract. Their ability to prevent or treat candidiasis is subject to debate. While many studies suggest that a daily probiotic can slightly improve imbalances that lead to yeast infection, others do not. A 2009 study in Letter of Applied Microbiology suggested that certain lactobacillus probiotic strains enhance the effect of antifungal drugs like fluconazole used to treat yeast infection. However, there was no evidence that the strains could achieve the same effect on their own. Gluten, actually, people with celiac disease, they should avoid gluten. Other than that, in measured quantity, like the diabetic patient, we are prescribed in measured quantity, atta or like wheat and wheat product, we can give, but whole wheat flour is always better than refined wheat flour or refined food. Refined foods should be avoided, like, and refined flour also. Actually, yeast, we are having yeast also, like people often wonder if they need to avoid yeast. Yeast should be avoided in yeast infection. It's a question. Actually, the yeast, in yeast, we are for making bread and all, we are using Saccharomyces cerevisiae. That is completely different yeast. That is completely different that from the yeast which are like infectious for us. In fact, this S cerevisiae, in fact, the opposite may be true. According to 2017, the journal Virulence, S cerevisiae is able to inhibit candida germ and clear candida infection in mice. In the same occurs in human may support the use of bruised yeast as a dietary aid in women. That means S cerevisiae is good for our health, for yeast infection. Protein, like as the patient is infected by infected, so little bit elevated protein we can give. Generally, for diabetic patient, we are giving 1 gram protein per kg body weight, and for yeast infected diabetic patient, we can give 1.2 to 1.5 gram protein per kg body weight. Like for diabetic patient, what we are giving like lean protein, eggs, fish, then omega-3 fat contain fish, then dal and dal product. This we can give. And like other diabetic patient, we are not allowing like organ meat, then shellfish. These are we are avoided for other diabetic patient. For yeast infected diabetic patient also, red meat and saturated fat containing food also avoided. Beverages, alcohol is discouraged on the Candida diet. Fermented drinks like cider and root beer are also generally avoided. The same applies to sodas or energy drink, whether they are sugar-free or not. Fruit juices, smoothies, milkshake, milk-based coffee, drinks, and other sweetened beverages like hot chocolates are also avoided. Caffeinated coffee and tea are allowed in small amount if they don't contain sugar, dairy, or non-dairy creamer. Herbal teas and chicory root coffee may be recommended as caffeine replacement as long as they are sugar-free. The Candida diet generally does allow for sugar substitutes such as stevia, monk fruit, xylitol, and erythritol. Herbs and spices like cinnamon and ginger can be used to add flavor and a certain sweetness. Fruits and vegetables. Fresh fruits and vegetables are allowed, but fruit juices should be avoided. Fresh, frozen, and dried foods that are high in sugar are generally excluded on the Candida diet. Juices made from these fruits or those that are sweetened should also be avoided. Low sugar foods like limes and lemons are okay, as are small portions or berries. Dairy, full fat dairy is often limited on the Candida diet with the exception of probiotic yogurt, ghee, and real butter in moderation in measured quantity. All sugary milk or yogurt products such as ice cream or frozen yogurt are usually avoided. Moldy blue cheeses, processed cheese, cream cheese, and cheese dipping snacks are also generally not allowed. Points to be noted: people who are pregnant or breastfeeding, the Candida diet should not be used in children, people with chronic hypoglycemia, including dumping syndrome, or those who are immunocompromised. Care should be taken for them. Actually, diet is always tailor-made. Preventing yeast infections. How we can always prevention is better than cure. A primary prevention strategy for people with diabetes includes keeping blood sugar level in check, monitoring vaginous balance of bacteria is stay at a healthy level. So blood sugar monitoring and blood sugar should be controlled. Knowing your blood sugar targets, maintaining a healthy diet with low amounts of covert and complex form of carbohydrate, drinking plenty of water, following an exercise routine, taking diabetes medication as prescribed by the doctor, and monitoring also. Other tips to help prevent vaginal yeast infection include 14, wearing breathable cotton underwear that's not too tight, keeping your vagina clean and dry, changing pads and tampons frequently, avoiding touching and using any vaginal products that perfumes or dyes, eating foods rich in probiotics like yogurt. Now time is lower. A case study for you all. This I will discuss either after the session or in future, or you can try it and let me know how you will manage for this case. The patient is a 68-year-old man with type 2 diabetes for 10 years. His current diabetes therapy consists of insulin and medication. Medication also, but he has lost his weight with last year since starting on canagliflozin and dulaglutide, and he has like this persistent fungal infection. He was experiencing persistent fungal infection. His A1C during hospital admission was noted, it was elevated, and it is like 11.5%. His height is 165 centimeter and body weight 60 kg. Now plan a diet for him. It's a work for you all. I will discuss after the session. Thank you. Thank you all for patient hearing. Thank you, Aparna.
Thank you so much, ma'am. This is known as experience. Ma'am, your experience of more than 25 years, we could see in the discussion which you have given us on the topic. And by listening to both the presentations, we could make out that the diabetes not only, it affects from head to toe, whether it is mouth, whether it is genital, whether it is foot, any type of infection. And we have been talking about COVID from last 2 years, where we have seen that if immunity goes down, you are more prone to infection, and this infection could cause a rise in diabetes, and people with diabetic and vice versa. Actually, people with diabetic are more prone to all kind of infections. We have seen in the last 2-year cases also, people dying from COVID, that it is not only COVID, it is other comorbidities which they were living with have caused the death toll to rise. So finally, the all good things have to come to an end. And today we have discussed about 2 troubles of diabetes. So we need to end the session with Z on a happy note, that Z will provide us information about effectiveness of xanthosylum aromatum. If we have noticed that xanthosylum starts with Z and it contains X and Y too. Tejobati or Tumru, I think it's the same thing as xanthosylum. If I'm not wrong, ma'am could correct me if I'm wrong. I'm so sorry for taking this. And it actually helps in curing oral and mouth sores given by xerostomia, and has antiseptic properties to help cure the yeast infection or any kind of infection in diabetes. So let's learn about this wonder plant from Vijaya ma'am. She is a qualified dietitian having a 19-year of experience as a dietitian and academician. She is the founder of RB Diet Clinic and has been working as an assistant professor of dietetic and applied nutrition at Amity University, Kolkata. Ma'am is officially visiting trainer at Reserve Bank of India, ZTC, She's the official trainer of Bangladesh Academy of Dietitian and Nutrition. And she's a teacher at Cognize Nutrition, where we have learned a lot from her in weight management. She expertise in weight management, metabolic syndromes, type 2 diabetes, PCOD, gastric and gut health. Recently, last around 15 days back in the IAPN conference in Delhi, she was a recipient of Excellence in Clinical Nutrition. Congratulations, ma'am, for that award.
Thank you.
She is a recipient and of Bitsy Con, the Influential Women Achiever of India 2020-2021, where she was awarded the Best Influential Professional of India in the category of Clinical Dietitian and Weight Management Consultant. She was the official dietitian of Femina Miss India East 2019. She was awarded the Best Nutrition Faculty Global at VLCC Healthcare Limited. She, as a founder of RB Diet Clinic, she was a jury at iGlam Mrs. and Miss Bengal 2021. She has a lot of articles published in her name. One is the impact of nutrition in COVID, which got published in IAPN Anniversary Edition 2021. She has been talking about nutrition and a lot of other things in various corporate offices in conference. So ma'am, the stage is yours. I would like you to take over the session and impart knowledge about this wonder plant.
Thank you so much, Aparna. I believe I'm audible.
Yes, ma'am, you are.
Okay. So first of all, thank you so much for this introduction. And yes, you have introduced my topic today also very correctly, that it is a magical plant which has got so many health benefits. And as we know, like in diabetes, like all other different body parts are also getting affected. So here this magical plant plays a very pivotal role in combating those other side effects of the diabetes also, and along with that, the glycemic control. So we'll be discussing in detail. So I believe I am being given the opportunity to share the screen.
Yes, ma'am, you can share the screen.
Okay. Is my screen visible?
Yes, ma'am, it's visible.
Okay, thanks. Well, so let us begin with the last alphabet of this A to Z series of diabetes, and I'm very happy and thankful today for giving me this opportunity to be the last speaker of their A to Z series of the second season. Well, while talking about the last alphabet, that is Xanthoxylum aromatum, probably this is the last alphabet which can be a beginning in the treatment of the diabetes if we are looking at from the alternative medicine or from the alternative treatment pathway. To give it a start, like it is also called wing or prickly ash or rattan pepper. I myself have seen this pepper when I visited Arunachal Pradesh. People of the Northeast India, they basically take this, we call it as jabrang. I have not written the name over here, but the local name in India, it is also known as jabrang. And it has got a very strong aroma. It has got an essential oil, I would say. And people, they take it with various of the foods as the spices. I mean, they're not using it in the curries or in gravies, but then we can simply crush it and you mix it with any of the dry food also, and you yourself can feel the difference that it is a very aromatic oil. You can feel it in the throat also. Let me tell you about it. So it is a species of plant in the family called Rutaceae, and it is an aromatic compound. I mean, it's an aromatic deciduous spiny shrub which grows at an 11 feet in height, and especially being available in Pakistan and also to across to the Northeast India, especially in Arunachal Pradesh, then Southeast Asia and up to Korea and Japan. And it is one of the sources of the spice of the Szechuan pepper, and also used in folk medicine, in essential oil production. And also people over there, they use it as an ornamental garden plant. So if you see the seeds basically, or these are the flowering parts, they look like this. This is the Sichuan pepper. The bark, fruit, seeds, and even the leaf of this plant is equally good in the treatment of the diabetes. Though these are all being done on an experimental basis, like when people, they saw that they're getting benefit out of it, so they started doing the experiment with it. So I would be sharing certain paper today here for a better understanding of it. So it is a source of an essential oil, water oil. So basically the oil that is being produced from this uh, plant, we call it as the water oil. And it is also being used in Nepal as a medicine. Like in Northeast India, they take it as a food, I mean, as a flavoring ingredient to the food. But in Nepal, literally, they are treating this plant as a medicine. So before going to the other segment, let us discuss about the magical part of it before going into the diabetes part of it. As you have already said, Aparna, in your session, and also as we have seen that the diabetes, it is not just being a problem of the blood sugar, high blood sugar also, but it is a problem wherein eventually they does affect our entire system. It can be a macrovascular damage, it can be a microvascular damage. It can affect not from the microvascular, but then it can affect like in the candidiasis, like it is equally causing, or it is equally playing a role as a contributory factor, as Kalpanadi has said, in the yeast infection also, and the various of the other things. So this armatum fruits, seeds, and stem bark, they are used in the treatment of asthma, bronchitis, indigestion, toothaches, varicose veins, diarrhea, rheumatism, dyspepsia, cholera. So this was reported by Kanjilal and Kirtikar in 1993. Also, it has been found to be very potent, like it is bearing a very potent antioxidant activity. The extracts are containing a good source of antioxidants. Being anti-inflammatory in nature, the ethanolic stem bark extract, they inhibit the cyclooxygenase enzyme, and it has also got an analgesic activity. That means it also helps in a painkiller kind of activity, which is present, the component which is responsible for the analgesic activity is basically present in the lignan components. Okay, now this being anti-inflammatory in property, it does help in reducing various inflammatory response. They also do occur due to diabetes. Also, it has been found to be hepatoprotective. Now we know that people who suffer from diabetes eventually has been found to be suffering from the liver disorders also. So therein also we can see that individually this Xanthosylum armatum has got a hepatoprotective activity also. The extract of the bark, it increases the level of the antioxidant enzyme, and thus they regulate the enzymatic levels in the serum. It also has got immunomodulation activity, which shows a stimulating effect upon the lymphatic system, circulation, mucous membranes, and also act as a stimulation lenient for rheumatism. People who suffer from rheumatism or pain can also be benefited by if they're consuming Xanthosylum armatum. Now, like having said this, it is not going to give the immediate relief in a day or two, but yes, eventually if someone can put them into their diet for a longer period, they can definitely get benefit out of it. So now coming to our today's topic, that is the role of Xanthosylum armatum in diabetes. So several developed countries, they've reported that almost half to two-thirds of the population affected with diabetes, they basically use complementary and alternative medicine to control the condition. In India also, you will see that many of the people, like we as a dietitians, we also give people that have methi, the fenugreek water. Fenugreek is good because it is containing trigonelline. So if you see, it is also a part of the complementary or the alternative medicine. We are talking about the giloy. Giloy is also good in reducing your blood sugar level. Then there are so many other home remedies that even our nani, dadi, and the people surrounding us, they also say that there's a flower in Bengal called Nayantara. At this moment, I don't remember the scientific name, but yeah, it has also been claimed that yeah, the Nayantara juice also helps in reducing the blood sugar level. So that, which shows that yeah, people has got a pattern, or like people, they like to try the alternate therapies or towards the control of the condition. And WHO has also recommended and has also encouraged that people should be going for the alternate therapy while in the treatment of the diabetes for a longer run. So xanthosylum armatum extracts from fruit, bark, and leaf has been found to be inducing hypolipidemic and hypoglycemic effects in one of the studies conducted by Fiaz Alam, Qazi Alam, and it was published in the year 2018 in the BMC Complementary and Alternative Medicine. The leaves and the bark extracts have showed a maximum of alpha glucosidase inhibition. Now, what does this alpha glucosidase inhibition? It does. I'll be explaining it to you in the next slide. The extracts have showed that it can lead to a significant decrease in the fasting blood glucose level compared to the diabetic control. Now, this glucosidase enzyme, what it does, like it catalyzes the hydrolysis of the starch. We all know that it catalyzes the hydrolysis of the starch to the simple sugar. So that means the glucosidase enzymes are the enzymes which are responsible for the increased level of the blood sugar level in our body once we are eating the starch and all, right? So in humans, these enzymes aid digestion of dietary carbohydrates and starches, which as a result produces glucose for the intestinal absorption. And thus, after being absorbed from the intestine, these glucose levels, they rise in our body. So this is how an alpha glucosidase inhibitor works. Basically, this alpha glucosidase inhibitors, they inhibit the conversion of the starch to glucose, and then eventually the carbohydrate digestion gets delayed, and then the absorption of the glucose in the bloodstream also gets delayed. And thus, as a result, the pancreas is getting sufficient time wherein the insulin level can rise in the body gradually. As a result, it is going to increase the glucose uptake, and thus it can reduce the blood glucose level. So this xanthosylum armatum is basically playing a role in inhibiting the activity of the alpha glucosidase enzyme, which as a result can lower the blood sugar level. And this experiment was done and reported in this article, as I have already mentioned. Now, another thing has been found that it can be an excellent source of natural antioxidants, and it also exhibited the anti-diabetic activity. This was published in the year 2020 only in Plant Science Today. So it could be speculated that the observed anti-diabetic activity of xanthosylum armatum might be related to the presence of the various phytochemicals and the phenolic compounds, and also they contain lot of mineral elements which are found to be the important constituent of the xanthosylum armatum. Phytochemicals analysis has revealed that these plants exhibit glycosides, alkaloids, terpenoids, flavonoids, saponin, and tannin that are frequently implicated. We all know that these items do have anti-diabetic effects. And along with that, the below mentioned minerals like magnesium, manganese, zinc, iron, then potassium, phosphorus, etc., are also important like if I talk about their role in regulating the blood glucose level. And this xanthosylum armatum is equally very much rich in these essential elements also. So while doing an evaluation of the anti-diabetic property of the aqueous leaf extract, they have done the in vivo and the in vitro approaches. This was published in 2018 Jan in the J. Complement Medicine. The plant extract has found to be showing a significant hypoglycemic and anti-hyperglycemic effect in the normoglycemic and diabetic mice. So this particular experiment they have done, they have seen it in the mice. And the elemental analysis, they revealed that these presence of these vital minerals like magnesium, iron, chromium, etc., are all known to be playing a role in regulating the blood glucose level. The results that also demonstrated that the Z-armatum aqueous leaf extract possesses anti-diabetic property both in vitro and in vivo conditions. The experiment which was done in the mice, they found a very beneficial role, or the beneficial role played by this plant extract in terms of reducing the blood sugar level. So this xanthosylum armatum leaves, the aqueous extract of the leaves, if I talk about the in vivo studies, the in vivo studies showed its effect on the hypoglycemic test, then effect as anti-hyperglycemic, then glucose tolerance. And in the in vitro studies, they have been found that it is having an inhibitory assay of the plant extract like alpha amylase, alpha glucosidase, beta glucosidase, lipase, hydroxy radical scavenging activity, and the elemental analysis and phytochemical screening. All these results demonstrate that Z-armatum aqueous leaves extract possess anti-diabetic properties. So how, like I have said, that the extracts are showing the hypoglycemic, anti-hyperglycemic test also, and they are also found to be a good alpha amylase or alpha glucosidase inhibitors also. So both way they are actually being able to control the rise in the blood sugar level. Now, in the streptozotocin-induced diabetic rats, this anti-diabetic activity of the xanthoxylum armatum bark extract was found. So far, we have studied about the leaf, the stem. Now it is the bark. Now, hydromethanolic extract of the bark of the xanthoxylum armatum, HMZA, is commonly known as, was evaluated for its antioxidant and anti-diabetic property in the rats which to whom the diabetes was induced by inducing streptozotocin. So bark of Z armatum, they possess a significant anti-diabetic and antioxidant effect on the diabetic rats also. And that also suggested that the plant may have a therapeutic value in diabetes and related complications. Tambulin is a flavanol, which is a major active compound of methanolic extract of fruits of the xanthoxylum armatum. So we can see that the xanthoxylum armatum, the fruits, the leaves, the bark, the stem, I mean, the plant as a whole is so very important for all of us, right? So this acutely potentiates the glucose-induced insulin secretion. So tambulin, this flavanol isolated from the xanthoxylum armatum, has found to be showing a very strong potent insulin secretory activity in our preliminary anti-diabetic screening by the biomedicine and pharmacotherapy. This was published in the year 2019. So even they have got this strong insulin secretory activity. So the takeaway, if I talk about, like, going by the fact sheet, I would like to read out the fact sheet as published by the WHO. The number of people with diabetes, it rose from 108 million in 1980 to 422 million in 2014. Prevalence has been rising more rapidly in low and middle income countries rather than in high income countries. Diabetes, we know, is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputation due to diabetic foot. We all know that we basically, when we have worked in the hospitals and presently also the dietitians who work in the hospital, unless and until it is an accident case, I believe most of us dietitians are going to admit that yes, we do suffer. Like we have seen that the people who are majorly being admitted in the hospitals has come up with the various conditions. They are the patients with who are suffering from the multiple morbidities, like comorbidities are there. But if you really see that almost everybody has got one thing in common, almost everybody, that is the diabetes. So we can say from these fact sheets also that the number of cases of hospitalizations are also due to the complications of the diabetes also in many of, and like almost in every household has got the diabetic individuals, and almost every household, the senior people, they are being admitted to the hospital due to the uncontrolled diabetes, or maybe due to sodium potassium imbalance, or maybe due to the renal failure. But the root cause, if you go and see, then that is the diabetes, right? So between 2000 to 2016, there was a 5% increase in the premature mortality from diabetes. Even the death rate has also increased due to the diabetes. In 2019, diabetes was the 9th leading cause of death, with an estimated 1.5 million deaths directly caused by the diabetes. We know that a healthy diet, regular physical activity, maintaining normal body weight, avoiding the bad habits can actually prevent or delay the onset of the type 2 diabetes. But the major why I have shared this takeaway of the, I mean, in the form of the fact sheet, this shows that how important it is to introduce the alternate therapies into our day-to-day system. If I really compare the population versus hospitals, the number is not going to be sufficient, because if so many people are getting affected with diabetes, and if so many people have to be admitted to the hospitals also due to the consequences of the diabetes, so it is very important to prevent the hospital stay, or to prevent the hospitalization, or to prevent the complications of the diabetes, it is very important if the alternate therapies, which are very easily available in our household things also, if it can be given from the very beginning, so that the ultimate end result, like people, they can avoid the complications of the diabetes, at least to some extent. So more and more people are leaning towards alternate therapies nowadays for the treatment. People are trying to grab their roots, and even WHO is also saying. However, a lot of research based on human trials is still needed for type 2 diabetes mellitus and type 1 diabetes mellitus in order to come up with the dosage of different components of xanthocyalam armatum, which truly can bring a revolution in the treatment of the diabetes. So with this, I end my note. Thank you.
Thank you so much, ma'am. It was really a very, very informative session. And we have really learned about this wonder plant, which each and every part of this plant could help us in some or the other way. And since now we are focusing on remission of reversal of diabetes and things like that, so we need to know about the alternatives which could help us in treating, and basically for the people who are pre-diabetic, who don't even know that they can become diabetic, so it might help them at an initial stage to, so that they can prevent landing up in complications of diabetes in the later years. Ma'am, I just wanted to know, in case what is the, since you have already told that the dosage of this plant is not yet fixed, so do we have any amount to be taken? What is generally prescribed, or what is generally given, so that it really helps the patient?
See, it is just like the fenugreek seeds, like the dosage of the trigonelline is not fixed, but then we all dietitians, like we do prescribe the fenugreek seed water in
Yes,
the
ma'am.
early morning, right? Like
Yeah,
1
yeah.
teaspoon of it. So now this is also a herb, a plant which do not have got some harmful effect on the body, because the people of the Northeast, they take it immensely in their diet. I myself, I have eaten, like when I went there, as I belong from the Northeast also. I'm Bengali, but I belong from the Northeast. So I have seen like how immensely people they are using it. They are boiling the food by putting some amount of jabrang into it. Then they are like, maybe they're roasting the chicken, then they are mixing, they're crushing the jabrang. Do we call it as jabrang over there? So they're crushing the jabrang and then mixing it up. So it is even like the dosage of the curcumin also, if you say that, we cannot
Yes,
say
ma'am.
that yeah, that
Yeah,
it is the, this is the dose that you can say. These are all your natural herbs, natural condiment spices. If it can be taken in a diet every day, at least some activity or some anti-diabetic activity definitely can be seen, like okay, my
sure.
blood sugar can be put into control. However, as I've said, if it can be bring into a supplement form, though the research works are going on, so far they have done the research into the mice, only 1 or 2 studies were there into the humans, but if they can actually do the research in fixing up the dose, because this is a magical plant which is not just having the anti-diabetic, but it has got antispasmodic, analgesic, anti your immunomodulatory, etc., antioxidant, very strong antioxidant. So we know that getting the our body gets affected with the effect of free radicals also in diabetics. So that, and that can lead to the cell apoptosis, further leading to the necrosis. So there, this, I mean, armatum can be given in terms of the antioxidants also, which can at least prevent the cellular damage to some extent.
Yes, sure,
So
ma'am.
along with being the, so the dosages are not being fixed, because even the dosages are not yet being prescribed anywhere, but yeah, it can be added in a daily diet, and it is very tasty also.
Okay, ma'am. So it's like a tasty thing to help you in controlling your diabetes, because
Absolutely.
people with diabetes generally feel that they are deprived of so many things. And once they land up into macro complications, they are deprived of so many food that their life really becomes a tasteless thing. So something which is tasty and something which can be helpful in their managing diabetes would really be a boon to them.
Yes, true.
So thank you all the speakers. I really thank for such an informative session, and it really helps us to become more. On behalf of Day, I thank everyone and making us more inquisitive to find out about X, the unknown factors which could lead a patient with diabetes to land up in complications, to land up in different type of troubles in treatment. Even the doctors faced uh, in difficulty in treating such patients. So the day is taking a great initiative in helping us to know about the different causes, different factors in dealing with diabetes, and about the unknown factors which affect people with diabetes, and helping us to know why such things happen, why aren't they able to manage it, how can we help them manage help them manage their diabetes, especially all of you senior dietitians, diabetic educators. It's really helping our society so that we can manage this disease which is killing so many people. And finally, giving us the knowledge about diabetes and helping us in preventing it. So finally, the prevention and cure is vital for all of us. So thank you all for this wonderful session. And I would request Kalpana ma'am, our day member, our senior dietitian, to give a vote of thanks and end this session of A to Z of diabetes so that we can conclude this session.
Today
Ma'am,
is
over
the
to you.
last. Actually, today is the last day of A to Z series. It's my privilege to propose a vote of thanks and acknowledge the contribution of all the eminent speakers of A to Z series of diabetes. Thanks to all our senior experts did great job enriching us with information about the diabetes from A to Z. And special thanks to all the audience who are with us from the beginning to till today. Without audience, one program can't be successful. And who are really make this A to Z series of diabetes successful. On behalf of Diabetes Awareness and you, I thanks to all the moderators who work very hard from back end also. Thank you, Aparna, for that.
Thank you, ma'am.
Thank you,
ma'am.
Aparna, and other moderator, other faculty also around the year. They have done a lot from the back end also, who are working in the computer. Thanks them also. From next series, we are coming with different activities. I request to everyone, please be with us. Thank you. Thank you, all of you. Thank you especially today, Vijaya and Kumal, because in a short notice.
Thank you for giving us the opportunity, at least to me. Thanks a lot.
Thank you so much, ma'am.
In
It was
very
a
short
really
period, we have arranged for today's program, like within 1 week. Like.
Thank you so much, Kalpana.
Thank
It
you,
has always
Vijaya.
been a pleasure to be associated with you and Day itself giving such a it's such a big platform which is doing day and night work for the people. So
okay,
thank you.
we'll do some work.
Thank you so much, ma'am. Thank you for the lovely information. Thanks, and a good night to all.
Good night. Good night to you all.